So welcome here today, everyone. As you can see, hopefully you know where you are. You're not meant to be in values-based healthcare or the Australian super thing down the corridor. And apologies if you are. Now's the time to get up and leave. A little history lesson, I guess, for those of you who aren't from Melbourne, but those of you who are. 250 years ago, the Wurundjeri people tended this land and this was their home. And on the Birrarung, what we now call the Yarra, down there, they fished, they farmed for eels and other food in the swamplands, which ran all the way east towards St Kilda. And there was a waterfall down by which they also fished, and they tended this land for millennia. And I just want to acknowledge the elders past, present and emerging of the Wurundjeri people of the Kulin Nation and thank them for that oversight of the land, the waterways, the skies, acknowledge their sovereignty and the fact that it was never ceded, particularly here in Melbourne, after the following the fraudulent treaty by Batman. But after the white settlers came here, if you were around this area, you would have been smelling and listening to a whole melange of smells and senses assaulting you from the Western market that sat on Collins Street and William Street just down there. And, you know, produce was being bought up. The settlers were starting to seriously displace the Wurundjeri people and make their mark on the landscape that we know today as Melbourne. Fast forward almost a century and a half or 2 centuries, and we came to the handing down of the Victorian Royal Commission into mental health. And the reason we all come here today is to sit and think about what we've learned in the ensuing 4.5 years and what we continue to learn and how we can bring that together, particularly in the design and delivery of integrated services, but more broadly across a whole wealth of aspects that the Royal Commission put forward some views on. And, you know, I think it's a really important opportunity, and we're really pleased to be able to facilitate this to bring people together, particularly from the mental health and alcohol and drug sector, but also, you know, other areas as well. This session is the fruit of months and months of hard work by people at Neami, and I particularly want to thank James Catino, Caitlin Jablonka, Priscilla Ennels, somewhere in the room, Simone Budge, Anita Holman, who's staffing the desk out there, Harriet Ferrance, and the Neami National Engagement Team for all the thinking and production that brings an event like today into fruition, and particularly to the presenters who are going to share their learnings, but all of you for being prepared to lean in and think about how we can do this better and how we can continue to evolve and develop a mental health and AOD system which really responds to the needs of the people we serve. The Royal Commission delivered us many insights. Some would say it just sort of rehashed a bunch of stuff we already knew, but not the least of which was the need for and the absence of the input of people with lived experience, their carers and supporters, into the service design and delivery of those services that we bring forward to support their needs. And I just want to acknowledge that those with lived experience, both in the carer space and in the space of having mental health challenges, bring a whole different aspect to their work, particularly those in designated roles, and thank them for the commitment they make in bearing their souls day in, day out to service users, to those of us who work in administration, to those of us who fund services, and just really express my deep appreciation for what they bring to the services that we design, deliver, and hopefully evaluate at some point. The Royal Commission also told us about the need, again, not a new thing, for greater integration, particularly between the AOD and mental health sectors. And those of us who work in this, again, we knew this, but they really urged us to think about inclusion, how we create supportive environments for people who come in with whatever their sort of issues that they face into services, to think about how we deliver services to them in a non-judgmental way, particularly, when we're talking about AOD, thinking about harm reduction, not lectures about what you shouldn't be doing. The Royal Commission talked to us about the importance of those services being inclusive. It also talked about what's, I think, one of the most wicked problems in mental health, not just because of the overlap between Commonwealth and state and the mess we created with federation, but the important issue of access and how we enable services, whether you want to use the term no wrong door, that you enable services to feel welcoming and supportive for anyone who comes in, be they people who have First Nations background, people from priority communities, communities who don't use English as their first language, who are more recent arrivals to these shores, and for us to think about how we deliver services that are inclusive. And the Commission also urged us in many regards to think about how we support the capability of our staff. Because unless we're investing in the training and support of the people who work for our organisations, be they clinical, non-government or government, unless we think about that, we're never going to achieve those visions, particularly around inclusion and ease of access for people. And we need to think about what we can do to ensure that staff have the right skills and have the learnings that are built on different perspectives. And today is really about us all thinking about those different perspectives, thinking about how we create an environment which is supportive for the people who use our services and their supporters, carers, and those who come with them in that service journey. Saying that stuff's really easy, right? We didn't need a big Royal Commission to do that, but delivering on that promise and thinking about how we put that into practice is a much more challenging piece of work. And today is about sharing the learnings and thinking about what we can do together to build a better, more responsive service system. While we're framing today's talk around mental health and AOD integration, the lessons that we hope you learn and the things that you take away are not just about those two particular aspects. It's really focusing on those broader themes of integration. How do you recognise and incorporate into your practice diverse worldviews? How do we think about integrating those diverse practices from the different streams or elements, AOD, mental health, the sort of community development framework that many NGOs operate from, peer work and clinical work, thinking about what we can do to position ourselves to support that evolution even further. And how do we integrate the different experiences and perspectives of providers, of which there are many in the room, but also funders, and how do we do that particularly at a time the moment where we're in a really resource constrained environment, and this is the work that we're looking to do today. So people can really think about how we take those lessons and share them amongst each other. Neami has 4 values, and one of those values is learning. And that's partly why we brought today together, so that we can learn from all of you, and all of you can learn from each other. It's part of how we think about our strategic aims of building collective partnerships and learning across the sector. So we're really excited that people have been able to come here today and think about and lean in and share what are sometimes uncomfortable learnings, right? No, the Royal Commission didn't fix anything. We all mushing about in sometimes the deep discomfort of how we work in integrated teams, how we design a system that better supports lived experience into our practice, and at the same time draws on the knowledge and experience of clinical work that's happened, of the work that's happened in the AOD sector as well. If we're going to do that, we've actually got to be humble about it and acknowledge the fact that others have diverse views. It's going to be uncomfortable sometimes to hear us be told that we're not doing it well or that we could improve. But that's what today is about. There's lots of great work going on across the sector, and we're under no illusions that Neami knows better than any provider in this room. But part of it is us sharing our learnings with honesty, and you'll hear from a range of presenters today who are going to talk to you about what they've seen, about what their thoughts are in terms of the learnings they've garnered over the last 4 years, but also how can we take those to build a better future for a system that does respond more ably and adequately to the needs of consumers and carers and their supporters. So it's really a time for us to sit and listen, but particularly in terms of how the teams designed this afternoon's session, it's about sharing. It's about thinking, what can we learn from each other to build on the progress that we have made? And there has been progress. In many places, I think there's still a lot of frustration that we could do better. It feels particularly, I think, in Victoria that the sort of resource-constrained environment has started to dismantle some of the aspects that were built only a short time ago to support a new and different system. But we really want to think, acknowledging that there are those constraints, what can we do together? How can we share that knowledge so that we continue to improve the services that we provide? It's going to be a time of reflection, and as I said this afternoon, it's particularly thinking about where we could have done better. And Neami's got lots of those lessons which we are prepared to share. And I think it is just that theme of resource constraint. If you wanted to duck across to the value-based healthcare session, but you probably get some better insights here. We see a national focus on healthcare productivity. We all know the challenges in attracting and retaining skilled workforces, particularly when we're seeing funding diminish, often in real terms, year on year. And so today, learning from one another is more important than ever. And we hope that you get great benefit from this, that you walk away with some new ideas, and particularly you walk away with some insights about how others in the sector are trying to tackle these, because we're all trying to tackle the same problems. And I hope it's a really rewarding and satisfying experience for you all. Thank you. I'm going to hand over.
I'm James Coutinho. I'm a research lead at Neami, and I've been lucky enough over the last couple of years to be doing an in-depth research project on our Neami integrated mental health and AOD services. And so in some of the presentations this morning, you'll hear about some of that work. But I just want to give a quick overview of the day and do some housekeeping before we kick off. So Tom kindly did the acknowledgement of country for us. So echoing what Tom said, the aims of today are to share lessons from integrated services, including what's working, but also what's challenging. To reflect together on integration challenges, so both on the ground within services, but also in the wider healthcare system, and explore possibilities for doing integration better in future, and to build connections between people in this room for future collaboration in things like commissioning, service delivery, and evaluating integrated services. So this is a chart of who's in the room today. And so there's folks from all across the sector, and I think this is a rare opportunity for us to take the time to talk to one another across our different roles and different organisations, so I'm pretty excited for that. So I just want to give a little bit more context on kind of the goals of today's forum. So this diagram shows a model of systems change, right? And it's called the Berkana two loops model. So it's just one idea about how systems change. But what the diagram shows is that systems change doesn't happen in a clean or linear way. So that top loop on the diagram there represents the dominant system. So maybe we can think about that as our legacy mental health and AOD system. And that system kind of rose and it peaked, and then at some point we realized, well, lots of aspects of it aren't fit for purpose, and it started to decline. And then at the same time, that bottom curve on the diagram shows the emergent system. So that's all the innovations and experiments and integrated forms of practice that have started to come together and are starting to look like a new system. And I think the point for me of this diagram is that at the moment it feels like we're in this kind of messy middle. So I was going to use my laser pointer, but that's not going to be helpful. We're kind of in this messy middle here, where it feels like there's still aspects of kind of the legacy, the dominant system, and then all these new ways of doing things are coming together. And the important point is that we can't keep experimenting in isolation or working in isolation. We have to kind of join these innovations together, work out what works, and support them so we can scale them into something that looks like a kind of more integrated system. And the point of today is to start to do some of that connection work among the people in this room. So the agenda today, in a few minutes, we'll kick off with the first presentation session, and that's about lessons on integration at the service level. Then we'll have morning tea at 11:30. Then presentation session 2 is about integration lessons at the wider system level. Then we'll have lunch. And then in the afternoon, we're going to do some roundtable reflective sessions that will be led by my colleague Caitlin. And those sessions are going to look at things like, what do we mean by integration? We're going to talk about told and untold stories of integration, and kind of possibilities for doing things better in the future. And then we aim to finish about 4 o'clock today, but we've built in a little buffer time, so you should be away by about 4:30. So this morning's presentations are going to highlight 6 different integration themes. At the service level, we're going to hear about designing services for mental health and AOD integration. We're going to hear about innovations in consumer support, and we're going to hear about peer and clinician collaboration. And then in the second session, we're going to hear about integration among sector organizations, partnership working, and upskilling the integrated workforce. So these are just a few of the kind of innovations and themes that are going on in the integrated space, and just a few of the challenges we need to think about if we're going to design better integrated services. And after each presentation, we're going to have a brief kind of critical reflection from someone in this room, from a leader from some part of this sector, and then we'll have audience Q&A. And I think the presenters here would really welcome your kind of critical reflections in your Q&A, critical questions, and just an opportunity for us to kind of learn from you, I suppose. So as we go throughout the day, we're going to come back to this idea of the integration iceberg. And so what we mean by this is that we have these told stories of integration, right? You're going to hear a lot of told stories of integration, and that's the top part of the iceberg above the water surface. So those are the kinds of things that we say we do in the sector. Things like there's no wrong door for consumers, things like our care and support is safe and inclusive. But the untold stories are the part of the iceberg that's below the water. So those are all the things that maybe we don't talk enough about. So how the integrated system can sometimes feel messy and difficult. Sometimes there's positives and sometimes there's negatives. And so as you hear the talks today, I'd like you to listen out for those told and untold stories, and you've each got a little A4 worksheet in your place. And feel free to jot down notes and ideas, but in the afternoon we're going to come back to that idea and do some reflection activities around it.